Hello, this lecture will cover the exocrine disorder of cystic fibrosis. Cystic fibrosis is a generalized dysfunction of the exocrine glands. It affects multiple systems. We're going to be just speaking in this lecture about the exocrine effects of this disorder. It's caused by a mutation in the CF regulator protein that impairs chloride transport. The mutated gene that changes a protein that regulates the movement of salt in and out of the cells, which is known as chloride transport. And that results in thick, viscous secretions in the lungs, pancreas, liver, intestines, and reproductive tract. Research has suggested that as many as 300 genes code for CF. It is transmitted as an autosomal recessive gene, and most commonly as an inherited disorder in children, and it's one of the most common causes of childhood death. If you're a carrier, there is a 1 in 4 chance of having a offspring with the expressed disorder. The presence of this gene can be detected in chorionic villus sampling after 11 weeks of gestation or with amniocentesis at 16 weeks to further confirm it. There are about 1 in 2,500 live births in the United States, equally between male and female, with cystic fibrosis. 5% of the population are unaffected carriers. That is about 1 in 31 Americans are unknown carriers. 30% of those now living with CF have lived into adulthood. In the late 1980s, those with CF could expect to live into their mid to late 20s. Since the discovery of the CFTR gene in 1989, the life expectancy has continued to increase. So the average life expectancy for those living with cystic fibrosis today is still only 37 years. And hopefully that number will continue to rise with advances in treatment and technologies in the future. The link on the slide will take you to a resource for those with cystic fibrosis. There are some really helpful videos and other tools and handouts for those that are having somebody with CF within their family or friends. This slide represents the multiple systems that are affected with cystic fibrosis. We'll be focusing on the pancreatic ducts and the effects on the bile duct. Pancreatic ducts and the bile duct. So due to that abnormal mucus secretion and obstruction, this causes secondary degeneration of the pancreas, pancreatic achylia, and that is just the absence of the enzymes within the pancreatic juices or pancreatic secretions. If those enzymes are not present, foodstuffs cannot be broken down and nutrients cannot be absorbed, and that leads to malabsorption syndrome. Within the bile ducts, it also increases pressure and leads to portal hypertension. There are some very unique and commonly occurring assessment findings in patients with cystic fibrosis based on that inability to transport chloride and the malabsorption that occurs as a result. These patients often have something known as diarrhea, where they have bulky, greasy, foul-smelling stools that even contain bits of undigested food. They have very thin arms and thin legs. They may have a distended abdomen, similar to children you'd see that are severely malnourished. These patients benefit from only about 50% of the food that they ingest. as a result of this, they are hungry all the time. They have, despite voracious appetites, they still aren't getting the nutrients they need and can be considered as failure to thrive. These patients also have a chronic productive cough, frequent respiratory infections as a result of the mucus within the airways, high levels of salt in their sweat. There's some testing that they do, and once they question whether this patient may have cystic fibrosis. And that voracious appetite is the last characteristic. So chest x-rays, KUBs, could diagnose any pulmonary or GI-related symptoms. Sweat testing is the test that is often done to secure the diagnosis. And it's based on elevated findings of chloride concentration. So that, along with clinical signs and symptoms, are what confirms the diagnosis of CF. So normally, if you were to measure the amount of chloride in sweat, normal is about 20 milliequivalents per liter. They use a cholinergic drug, pilocarpine, that stimulates sweat activity. It's collected via a filter paper and then measured. So 20 milliequivalents per liter is a normal. Greater than 60 milliequivalents per liter would confirm the diagnosis. Stool analysis would confirm the steatorrhea. DNA testing, I mentioned that in a previous slide. Pulmonary function testing for those with to confirm obstructive disease related to the mucus buildup in the airways. And numerous labs would be done: liver enzymes, albumin to represent protein deficiencies, electrolyte imbalance, and sputum cultures are all commonly done diagnostics. Treatments for cystic fibrosis can become, central for attention for the patient as well as the family. Often when one child in the family, or it could even be two in the family that might have cystic fibrosis, from the moment they wake up till they go to bed, they're continually having to be reminded of medications and treatments and things they should eat and not eat, supplements, assessing for infections related to and complications related to their cystic fibrosis. They're a part of their daily life. Patients are required to take pancreatic enzymes because they have that lack of enzymes in their ducts related to the mucus effects. They have to take synthetic pancreatic enzymes. So that includes the 3 types of enzymes that break down starches, fats, and proteins. And there are several different meds. Creon, so pancreolipase is another medication. So the patients take these with their first bite of food, with all meals and snacks, and especially things that are high in protein. They would want to make sure they take so they can break down the protein for its nutritional value. They may be on antibiotics prophylactically, or definitely if they would have an infection, whether it be respiratory, which is the most common infection for these patients. Anti-inflammatories may be indicated. Mucolytics are definitely given on a daily basis. And patients use a combination of chest physiotherapy with vibratory vests, postural drainage. They have these inflatable vests. They may combine everything together where they use their flutter device and their nebulizers every morning while they're using their inflatable vest therapy. So they try to use their time well so that they have as much normalcy as possible. In terms of nutrition, there are some medications that we know create mucus. That would be things like dairy products, butter, milk, cheese, corn, cottage cheese. So this slide pictures all the things that would be high in high in terms of creating mucus, and then there are foods that help eliminate mucus, and those are your most often vegetables that help decrease mucus. They should be encouraged to eat 3 meals and 2 to 3 snacks per day with their pancreatic enzymes, and have foods that are high in protein and fat with the enzymes. Nutrition shakes are encouraged, and also the vitamin supplements. So especially those fat-soluble vitamins that are really important for breaking down foods. So the fat-soluble vitamins include vitamins A, D, E, and K, which are not stored well in people with cystic fibrosis. And these are produced by the liver, and it's really important to be aware, especially with vitamin K. If there are deficiencies of those supplements, we can see problems with bleeding. So that's important to make that connection between patients who have deficiencies in those fat-soluble vitamins and issues with bleeding.